Hi guys, my name is Dr. Doug Swanson. I've actually attended the same Bradley class that you're attending right now. It's an amazing class, and I think you'll find that your teacher is very knowledgeable about what's going on in the birthing method that you're learning at this point in time. I am a pediatric and family wellness chiropractor. I have a lot of experience with children and kids and pregnant moms. So I just wanted to take a second, I can't be there today because it's actually my birthday. So I just want to take a second to explain a little bit about chiropractic and give you a basic understanding so that you're confident and so you can see how chiropractic may benefit you through your pregnancy, but also more importantly benefit your child when that time comes. So chiropractic, if we could break it down, we could do this really quickly and really simply. Your brain is like the central computer within your body. It runs the show. It's the air traffic controller. It controls absolutely everything. So your brain literally sends messages to all parts of your body. So for instance, your brain tells your heart what to do. And without that message, your heart can't beat. So your brain has to get a message from here to here. And to do that, it uses your spinal cord, which runs from the bottom of your brain all the way down to the bottom of your tailbone. From that spinal cord are all nerves that branch off to all parts of your body, and that is called your nervous system. Your nervous system is the master communication system of the body. It is what is telling your baby right now how to grow and develop and do what it's supposed to do inside your tummy. Okay? So the cool thing about our nervous system is it's protected by bones. So we know that our skull protects our brain, right? And the 24 bones of your spine are what protect the spinal cord and the nerves. And as long as your spine is in proper alignment, all those messages can travel from your brain, down the spinal cord, out the nerves, to all parts of your body. And that means your body's going to function like it's supposed to. If, for instance, one of those spinal vertebrae, those areas of your spine, get out of alignment, it could put pressure on that nerve, causing discomfort and irritability, especially as you get further along in your delivery and your pregnancy. It can also interfere with the flow of messages, kind of like a kink in a water hose. It's not going to allow that message to flow from the brain down the spinal cord and out the nerves. It's going to get stuck, and that's going to create issues with the body's ability to function. Now, that's important for you and I, and so in chiropractic, we call those misalignments, we have a very fancy word for that, we call that a subluxation. And all chiropractors do is detect and correct subluxations, and we do it to the very best of our ability. And there's really no age limit on how old you have to be to get a subluxation detected and corrected. My daughter was 10 seconds old when we first checked her spine, because I actually had her at home in the water and water burst, so it was very easy for me to get there right away. And the reason that is because I wanted to make sure that she had no interference to the communication of the messages from her brain to her body. And it's so very important because our children have what we call genetic windows of opportunity. Those windows of opportunity have the potential for their body to develop and grow and do everything it's supposed to do. And that subluxation can literally interfere with their potential. I know I don't want that. I know you don't want that. So if you think it's a wise idea, I do, you should have your children checked. And you should also be checked right now, okay? Because it's so very important. Let me give you just a quick example. This is your spine and this is your pelvis. So right now the baby is inside you growing right here. And as long as your pelvis is stabilized and right where it's supposed to be, the baby's in a good optimal position for growth and development. But if your pelvis tweaks out of alignment like this or gets twisted and moved, that puts strain and pressure and stress on the baby. And so now the baby's not in an optimal position for growth and development, and we have some issues. So what chiropractic can do is help to realign the pelvis, put the baby in a more optimal position for growth and development, making your delivery process easier because the baby is able to go right down and out through the chute. And there's actually studies that say chiropractic care through pregnancy can actually reduce your labor time by 1/3. And I don't know who out there doesn't want that. Every mom I know wants to have their labor times reduced by 1/3. So guys, chiropractic is amazing. It's essential for life. It's essential for our kids to develop optimally and have full potential. It's essential for you to have the best delivery and pregnancy possible. I'm looking forward to getting to meet you if I can. Tell your teacher it's such an awesome experience to learn through the Bradley method. Hope you have a great day.